Hi, my name is Charles Kuntz and I'm a surgeon at Southpaws. Today I'm going to talk to you about the removal of a fragmented medial coronoid process from a dog with elbow dysplasia. We're also going to do an ulnar osteotomy in order to unload the medial compartment of the elbow. So the first thing we do is place our egress cannula, which is an 18-gauge needle passing through the triceps tendon and into the joint from the caudal aspect. We then inflate the joint with saline and placed our telescope portal, which is just distal and palmar to the medial epicondyle. A number 11 scalpel blade is then used to widen the portal so that the telescope can be introduced into the joint.
And we can stop recording, please.
And I'm still recording.
Yes. Okay, you can stop recording.
And turn lights also.
Yeah.
Can you describe that 18-gauge needle that's just sitting on the tray?
Now can you record a
The
little
camera
bit?
and the light source are
You can turn
connected,
that
and then the
recording
joint
off.
is explored.
Sorry.
Here we can see some synovial proliferation along the joint capsule. There's the semilunar notch, and then the medial coronoid fragment can be seen clearly. There's also full thickness cartilage loss on the coronoid process as well as the distal humerus, consistent with severe elbow dysplasia. The coronoid fragment is then elevated using an 18-gauge needle, which will also serve as our instrument portal. After the coronoid fragment is released using the 18-gauge needle, a number 11 blade is passed down along the needle in order to enlarge the portal for introduction of an instrument. Cup forceps are then introduced into the joint in order to grasp the medial coronoid fragment. It is then pulled out through the skin, and in some cases the skin portal actually has to be enlarged to accommodate such a large fragment. We then make a small incision on the palmar lateral aspect of the antebrachium over the mid-shaft ulna. We're going to create an oblique ulnar osteotomy, and the osteotomy is oriented so that when the triceps pulls on the olecranon, the distal ulnar segment will not completely luxate. The ulna is exposed using Hohmann retractors, and then an oscillating saw is used to make a cut in the ulna, again in the oblique direction. The oscillating saw is lubricated and cooled using normal saline. After the osteotomy is completed, the fragments are mobilized.